Good morning, and thanks for joining us. I'm Melanie Hall, and we're here at the Pig Place. We've been asked to share with you how we address and assess social determinant factors and their role that it plays in helping people reach their healthiest self. We believe that social determinants are a key factor in helping people reach their healthiest self. How much so is important to understand. In a study conducted by the National Academy of Medicine, they found that healthcare services alone attributed to only 10 to 20% of a person's health outcomes, which leaves 80 to 90% that they attributed back to social determinant factors. That's significant and staggering to consider when we as healthcare providers are responsible for those outcomes. So we need to know what social determinant factors are and how to effectively address them with patients. The World Health Organization gives us a definition of social determinants. They are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. Wow, when you think about that, that takes into account all that we are as people. But if you think about it outside of the healthcare environment and more in terms of person to person, it makes a lot of sense. A diabetic patient, maybe one that we take care of here who doesn't have reliable transportation, struggles with access to healthy food choices, who lives here in this rural environment where they travel 30 to 45 minutes to see their primary care provider, it's going to be more difficult for that person to get their A1C into normal range. And without that occurring, numerous other health conditions present. When we understand how important social determinant factors are and compare them to how healthcare is encouraging us to address them, we're presented with lots of inefficiencies and frustrations. Providers are frustrated, the tools are inadequate, they are outside of our training, and frankly, there's not enough time to do one more thing in a visit with a patient. Patients too are frustrated. They're handed an iPad with a dozen yes or no questions. Do you have reliable transportation? Do you have stable housing? And as they answer no to each of those questions, they become more and more disheartened and frustrated. They know that there are problems within the system. In our community, a wait list for subsidized housing is now closed. Once it reaches 24 months, the wait list closes. So to hand them a resource that says visit your subsidized housing list or office is not going to help them. Here at PIC, we are, for one thing, not willing to accept that that's the best that there is. We constantly ask, is there a better way? Is there a better way that we can serve patients, serve the staff who work here, and reach the best possible outcome? We're going to share with you today our Circle of Support, which was developed in-house as a way to address social determinant factors. If nothing else, you're welcome to use it if it fits your practice. But if nothing else, I'd like it to challenge you and inspire you to ask, is there a better way? To understand what inspired us to create the Circle of Support, you have to know first that we really operate first from a belief system. That belief system then helps us craft our approach, and then our resources, our tools, our interventions become the behavior that stems both from that approach and our beliefs. So we ask ourselves, what do we believe? And we start from there. In creating the Circle of Support, we first believe that every patient wants to live their healthiest life. You can see there on the Circle of Support how they are focused right in the middle. They are not just our partner in this work, but they are the lead. They will be needed to be honest in what their needs are, engaged, and create positive change. And our job is to help them through that process. We believe poverty and the accompanying social determinant factors are overwhelming. If you think about what overwhelmed you in the last week, imagine that it's the things that overwhelm our patients. Where the meal for their next child would come from, how they'll stretch the tank of gas over an entire week until they get paid. Those types of things are overwhelming and hard to know where to start. So the tool needs to be simple, needs to be organized, it needs to be understood by the patient and those who are working with them, like our staff. It's one page, it's a picture, and it factors into our next belief, which is that every employee at our practice has a role to play in social determinants. It may be the medical assistant, the dental assistant, a provider, a billing staff member that works with the patient on the circle of support. It is something that we choose to partner with patients not because of our healthcare training or background, but simply because we believe that people need to be worked with as people. And the dialogue part of this tool is what's most important. Although it's everyone's job, it's important to know that successful implementation requires ownership and a leader. And for this reason, it lives within our behavioral health department. Next, we believe that those who live in poverty have deep reserves of resiliency and innovation. They've gained this through fighting through adversity. We capitalize on those strengths, not just identify deficits, in helping them craft an approach that will help them be their best self. You'll find that patients will tell you stories of how their trailer park neighborhood, they've created a barter system where one neighbor will take others to their medical or dental appointments in exchange for their children being watched in the evening while they go to their shift work. Those are problem solving at its best, and it's how things really get done. They also would not show up on traditional social determinant screeners. So we listen to people and we learn very valuable information that helps us move them forward. Finally, we believe that this is long-term work. We are committed to sustainable solutions, helping our patients become problem solvers, educating them, empowering them, and engaging them in the whole problem-solving process. We work this into the model by allowing patients to prioritize the top 3 areas where they want to start. And not surprisingly, as Maslow espoused in his model, that they start often with a basic human needs level and move up. We know that there is cost in doing this, that sitting down and having dialogue with patients is time-consuming and expensive, but it really nets exponential gains.
I hadn't really received any training on how to address the psychosocial determinants of health before I came to PIC, and when we introduced the circle of support, I couldn't have anticipated how much it would impact my taking care of patients. One of the first times we did it, a patient mentioned that she was having trouble affording healthy food, and that's why her diabetes was uncontrolled. And when she said it, I realized I had heard her say that before, but because it wasn't in my mind as something that I should address, it had never stuck. I didn't realize she had been saying that before. She'd been asking for help with her diabetes, but not through a prescription for insulin, but with assistance getting healthy food. And so since then, I've discovered with so many patients that we as doctors come into the visit with an agenda. I want to get the A1C less than 9. I want to get the blood pressure at goal. I want to get them taking their inhaler twice a day. And patients can feel like we're lecturing at them and telling them you have to follow all these rules. But if we approach the patient as a whole patient the way they are, they see themselves not in the tiny sliver of time that they're with us, but everything happening in their life. And if we address them in their whole life, they feel like we're partners, and they're willing to listen to our advice about diabetes and COPD because they know we care about where they live and how they're getting food. And if ever I had any doubt about how much this affects my relationship with patients, a moment I'll never forget was when the behavioral health therapist and I together were doing a circle of support on a patient. He has a really severe rheumatologic disease, clearly medical complications, needs doctors, has been dismissed for being non-compliant, not always following the rules. And we did the circle support, and one of his repeated main goals and needs was regular food. And I might have understood he needs help with food, but through the conversation, what I learned was his sincere goal was to try to make sure he could eat one meal a day, because sometimes he went days without any food. And when we realized how severe that was, like that his health goal was to eat one meal a day, we got him a gift card, and it wasn't even for that much, but we gave him that gift card so he could get some food. And he sat there crying because it meant he'd have a meal that day. And I realized I need to know my patients that way before I can influence them in terms of diabetes or the other things that we focus on.
The circle of support is really helpful in allowing us to sort of bridge the gap between medical care and everything else that supports a patient in terms of their full psychosocial health. And having that in place allows us to utilize resources and bring in a whole team of people rather than just a medical provider and a behavioral health provider in isolation. As a new provider working here, I had a really hard time at first reconciling the complex medical needs along with people's chaotic psychosocial situations. And the circle of support was really a great way of bringing other people in and involving them in the patient's medical care and realizing that I wasn't alone in caring for them. And it also allowed me to recognize the resources in the community really quickly. So I'm constantly adding to my toolbox of ideas that I can use for other patients. And I think the circle of support really brings that all together in an easy, accessible way. The circle of support has also been really helpful in allowing me to recognize barriers patients have before I start recommending things that are out of their reach. And so it allows us to more efficiently care for the patient and recommend interventions and treatments that are actually something that's attainable for the patient.
We have implemented the circle of support at the Pig Place since 2018. We knew early on that we needed to work with patients on the things that were part of their life, and so this tool developed during that time. Originally, we did it just for patients who were risk stratified in a high-risk category. We've since seen the value of it and expanded it to more and more patients. Just in the last year, we worked with the University of San Francisco to code the screener into our electronic health record so that it can be scaled up and takes a little less time to complete and update with the patient. We were asked, how do we train our staff to do this? I think the best training is to allow them to experience it. We sit down with a staff member and take them through this circle of support. We're talking about extreme needs today in terms of social determinants, but all of us have them, and we could benefit from a plan, a well-organized plan, a partner that will help us identify goals and keep us accountable. And so staff really see the value as they work through it in their own personal situation. They understand that it's not a clinically trained position, it's simply people being people and reaching out to help one another. We have a ready source of community resources that we connect people to. It's not just a blanket list, but rather contains insider information, like the wait list for affordable housing being closed, whether or not your citizenship will be asked when you go to a certain organization, if bilingual staff is available at the food pantry that we send you to. All of those are things that can potentially create obstacles to people getting the resources that they need. We know our community partners well, whether they're the school counselors at the elementary schools, the area agency on aging, public transportation, because we know that a circle of support is really that, involving different people, different roles, and different organizations to support the patient. The circle of support is a different type of tool, and so it requires a different type of measurement and assessment. Think about it like running a marathon. The time from when you decide to run a marathon, you set that goal, and the day that you cross the finish line, a lot of time passes. There's opportunity for your motivation to go up and down, for you to have other priorities that take over your time. And so what we do is we create incremental efforts that are going to take us from day one to the day of the race. We create running logs. We map out food plans. We find mentors. And all of this is done to help us measure our efforts that will help us accomplish the race. So that's kind of how we measure our social determinant program. We measure staff efforts. We measure patient efforts. And trust me, the outcomes will follow. We were awarded a patient family engagement award from CMS at their national conference in January of 2019. They were looking at the numbers. We cut per member per month total cost of care by 16%, which is pretty unheard of in this high needs population. We had engaged patients. Our patient satisfaction levels continue to be in the high 90th percentile. We had cut costs. We had accomplished very positive health outcomes as represented by our CQMs. And we had created an environment where staff enjoyed doing their job. They knew patients better. They felt like they had time, which really they had gained only in giving the time that it took to administer the Circle of Support. But it was creating more meaningful, long-lasting relationships and improving people's health. So I encourage you, push the boundaries. If the tool that's in front of you is not meeting your needs, redesign it. Reach out to others, reach out to us, and let's level up the way that we care for patients so that we reach a healthier community.